I am Dr. Harsha, Senior Consultant, Clinical Oncologist at Fortis Cancer Institute, Bannerghatta Road, Bangalore. Today, I am here to bust some myths about breast cancer and give you certain facts which will help you to understand breast cancer. That's a fact. The interesting aspect is that when a female becomes pregnant and then gives birth to a child, and the fact that she breastfeeds the child suppresses the estrogen for a long period of time. So the driving estrogen is reduced as a factor, and therefore people who breastfeed, they have a lesser chance compared to nulliparous women in terms of breast cancer. That's a myth. Okay, the fact is breast cancer can happen both in men as well as women. However, the incidence of breast cancer in men is very low, for the simple reason that the driving factor for breast cancer is a hormone called as estrogen, and estrogen is present abundantly in females and in very less quantity in men. So to conclude, breast cancer can happen in men, but it is extremely rare. No, that's a myth. The reason being, as the breasts develop in females, the lobules get formed and there could be normal lumps also. What I mean by that is that in a developing breast, lumps can happen and disappear. Apart from that, in teenage time, there is something called as fibroadenoma. We call it as a mouse in the breast or a rat in the breast, which is a completely benign condition. So all lumps in the breast are not cancerous. You need to examine them and go to your nearest doctor to understand whether it is cancerous or benign in nature. That's a myth. You need to understand that breast cancer is more sporadic in nature. That means the chances of getting a breast cancer increases as one ages, and you need not necessarily have a family history. If you have a family history, of course, we do check for certain mutations called as BRCA genes and others. And if those mutations are there, then with the family history, more than one family member being positive, there is an increased risk for breast cancer. So you need to understand that the breast cancer predominantly happens de novo, that is sporadically in new patient population, that is families, and it is not necessarily related to a family history. That's a kind of a fact. The understanding which you need to have is that even though estrogen is responsible for the breast cancer per se, the damage to the DNA happens because of free radicals or the other toxins. Smoking as well as alcohol can increase the number of free radicals and damage the tissue which is vulnerable. That is, the DNA damage can increase. So smoking as well as alcohol can increase your risk for breast cancer. That can be taken as a fact. There is a breast cancer of the nipple where just a crusting or a layer can be there. Bleeding discharge from the nipple, which is mostly in the postmenopausal setting without a lump, can also be indicative of breast cancer. So it's correct. You do not necessarily always have a lump in the breast which would indicate it as a breast cancer. At times, breast cancer could be lurking in the breast without a lump. That's a myth. You need to kind of appreciate the fact that over a period of time, the younger population is also at an increased risk for breast cancer. In urban cities, especially Bangalore, Mumbai, Delhi, we find that females as young as 25, 30, 35 are unfortunately getting breast cancer. There could be various reasons to this, including lifestyle and the other habits, but it remains a fact that young females can also have breast cancer. Having said that, breast cancer is a disease of the old age. What I mean by that, postmenopausal women are the females with the highest incidence of breast cancer. So it is a kind of 80-20 rule. 80% of the females probably are postmenopausal, but then yes, 20% of the females could be younger than 40 years old. So in short, today you learned about certain myths and facts. One important take-home message which you need to understand is cancer is curable if treated early, and especially slow breast cancer. Stage 1 breast cancer or stage 0 breast cancer, the survival rates are 90% or 95% plus, and that is for a 10 years plus period. So detecting early and getting treated early is the crux of cancer treatment. Wish you health always.
Don't forget to like and share this video. For more such videos, do subscribe to the MFine channel and hit the bell icon to never miss any update.